Good afternoon, sir, and everyone who will be looking at my presentation as well as who will be listening. So this is a video that I'm actually doing in pathophysiology. What I'll be doing is that I'll be discussing the celiac disease. My name is Khonti Mampuru. Student number is 2171-25464. I am a second year clinical technology student. The digestive system. This is very important. The celiac disease actually affects the digestive system. Where does it affect the digestive system? Within the small intestines. Where in the small intestines? Within the lining of the villi. So this is an example of the normal villi, and this is the celiac disease villi. What's the difference is that the finger-like projections, which are normal, are not present when you have a person or a patient with the celiac disease. They become very damaged. Introduction. What is celiac disease? The celiac disease is a hereditary autoimmune disease affecting the lining of your small intestines. If you have a celiac disease, what does it mean? It means that you're unable to eat or congest anything that's got gluten. So you become a gluten-free dietary person. And then, which are the substances that contain gluten? We have wheat, we have barley, and we have rye. So forth, also rice, but with the different types of rice that I actually make. Symptoms that you can actually have, they actually differ and vary from person to person. Some show little to no symptoms at all. Children do show symptoms, and some adults have severe symptoms. So this becomes a bit different. And then a symptom that can actually be present, a common symptom, it's a gastrointestinal symptom or a disease or problem. We also have anemia, also very common when presenting with the celiac disease. A person who has gluten-free diet has a celiac disease. Therefore, it means that they are not under any medication, but they're just trying very much to actually eat as healthy as possible. These are ways to identify the celiac disease, the signs and symptoms. We have diarrhea and constipation. We have abdominal pain and heartburn. We have bloating, fatigue, brain fog, anemia, pain joint. We have tooth enamel. We have muscle pain. We also have numbness and tingling in legs. We have weak bones. We have infertility, which affects both male and female's reproductive system. Then we have joint pain. Unexplainable weight loss is also a common sign and symptom. Causes of the celiac disease that one should look out for is that when you have a celiac disease, your body actually reacts to anything that's got gluten inside. What does it mean? It means the reaction of the body damages the tiny finger-like projections, which is on the villi. And then this happens that the villi then absorbs the vitamins and the minerals and other nutrients from the food you eat, meaning no matter how much food you're able to eat, it's still not getting absorbed in the correct places. This then actually leads to risk factors that you should actually take note of. We have like celiac disease that can be hereditary from family members. We have diabetes type 1. We have Down syndrome or Turner syndrome. We have Addison's disease. We also have autoimmune thyroid disease with also microscopic clitoris or lymphocytes or collagen clitoris. Complications if they left untreated, this was what happens. We have malnutrition, we have bone weakening, we have infertility and miscarriages, we have lactose intolerance, we have cancer, and then we also have nervous system problems. This is if the celiac disease does not get any form of being visible to a patient, or the patient actually not noticing. These are the complications that a person can now have and can now consider them. The abstract. This is based on the patient report that I'm doing on Mr. X, who is a 40-year-old man hospitalized with spontaneous muscular hematomas and whom is diagnosed with CD being the celiac disease. So research is being conducted of Mr. X. Laboratory tests confirmed that he is positive and he does have the celiac disease. However, Mr. X did not show any symptoms and he was also not involved in any risky behaviors that could have led to this. Therefore, this means that it could have been something that is very common. It comes with the genes, it's hereditary. So here I'll be actually explain that how Mr. X and other 47 patients that were actually aged 19 to 74 of years being part of the research that was conducted. The patient case report. Mr. X, he was presented to the emergency room for a sudden onset of spontaneous ecchymosis and muscular hematomas. He denied any recent activity of risky behaviors. For 3 days, presentation that he has been following are anti-inflammatory drugs, renal colic, and physical examination marked. Then what happened is that signs and common symptoms Mr. X did deny because he did not show anything that was present. Poor appetite, bloating, abdominal pain, diarrhea, those are the symptoms. One thing you should actually note is that most adults have symptoms that are unrelated to digestive system problems, such as anemia, osteoporosis, osteomyelitic, and blisters on the skin, rashes, itchiness, damage to dental enamel, ulcers in the mouth, fatigue, damage to the nervous system, aches in joints, and also head and acid reflux, as well as heartburn, which are some of the symptoms that are unrelated to the digestive system because they become very common. You can have joint problem and have nothing with the digestive system. You have arthritis. So this is why it was a bit difficult for Mr. X to actually notice that he's very, very sick. When Mr. X came to the hospital after those 3 days where there was very concisive, critical measures that were done to actually note what is happening with him, he was admitted to ICU, where extensive hematomas and drops in hemoglobin levels were actually first noted, followed by few favorable recovery after 72 hours of blood transfusion and nutrient support. That's where he started actually picking up. So upon history taking for Mr. X, he could recall some stools and few years past that other evidence of malabsorption were present. Testing for CD antibodies which were positive. His triglycerides were actually abnormal, and then Down syndrome and Addison from the family member that Mr. X has. So these are things that could have contributed to Mr. X having CD. This is within the 10 days after admission.